Osteoarthritis is one of the most common joint disorders, affecting millions of people worldwide. It's often referred to as the wear and tear arthritis, but its development is more complex than simple usage over time. In this video, we'll explore how osteoarthritis develops, what happens inside the joints, and how its progression can impact daily life. Understanding the stages of osteoarthritis can help individuals recognize early signs and seek timely intervention. Let's begin by looking at what osteoarthritis actually is and why it matters. Osteoarthritis is a chronic condition that primarily affects the cartilage, the smooth, slippery tissue covering the ends of bones in a joint. This cartilage allows bones to glide over each other with minimal friction. When osteoarthritis begins, the cartilage starts to break down, leading to pain, stiffness, and reduced mobility. The process is gradual and can affect any joint, but it's most common in the knees, hips, hands, and spine. Let's dive deeper into how this breakdown starts and what triggers it. In the earliest stages of osteoarthritis, changes in the cartilage are subtle. The cartilage may lose some of its elasticity and become more susceptible to damage from minor injuries or repetitive stress. At this point, you might not notice any symptoms, but microscopic changes are already underway. The joint may start to lose its ability to absorb shock, setting the stage for further deterioration. This silent phase can last for years before any pain or stiffness is felt. As osteoarthritis progresses, the cartilage begins to thin and break down more rapidly. Small cracks and rough spots may appear on the cartilage surface. This damage reduces the joint's ability to move smoothly, and friction between bones increases. The body may respond by producing more synovial fluid, leading to swelling. At this stage, people may start to notice occasional joint pain or stiffness, especially after periods of inactivity or overuse. With ongoing cartilage damage, the joint environment becomes more inflamed. The synovial membrane, which lines the joint, may become irritated and produce inflammatory chemicals. This inflammation can further damage cartilage and surrounding tissues. Swelling, warmth, and tenderness around the joint become more noticeable. These inflammatory episodes can come and go, but over time, they contribute to the overall progression of osteoarthritis. As cartilage continues to wear away, the bones underneath are exposed to increased stress and friction. The body tries to compensate by forming new bone growths, called osteophytes, or bone spurs, around the edges of the joint. These bony changes can alter the shape of the joint and restrict movement even further. The joint may start to feel stiff, especially in the morning or after periods of rest. One of the hallmark signs of progressing osteoarthritis is the narrowing of the joint space. As cartilage is lost, the gap between the bones decreases, which can be seen on X-rays. This loss of joint space leads to more bone-on-bone contact, increasing pain and limiting movement. Everyday activities like walking, climbing stairs, or gripping objects may become more difficult as the joint loses its cushioning. As osteoarthritis advances, the muscles surrounding the affected joint may weaken due to reduced activity and pain. This muscle weakness can lead to instability, making the joint more prone to giving way or feeling wobbly. Instability increases the risk of falls and further injury, creating a cycle that can accelerate joint deterioration. Strengthening exercises and physical therapy can help counteract these effects. In the later stages of osteoarthritis, pain often becomes more persistent and less responsive to rest or over-the-counter medications. The pain may be constant, affecting sleep and overall quality of life. Activities that were once easy, such as walking or standing, can become challenging. This ongoing pain can also lead to emotional effects, including frustration and depression. Over time, the combination of cartilage loss, bone changes, and muscle weakness can lead to visible joint deformity. The joint may appear swollen, misshapen, or enlarged. Fingers may develop bony knobs, and knees may bow inward or outward. These deformities not only affect appearance, but can further limit function and mobility. As osteoarthritis progresses, the joint's range of motion becomes increasingly limited. Scar tissue, bone spurs, and swelling can all contribute to stiffness and difficulty moving the joint through its full range. Simple tasks like bending the knee, opening a jar, or turning the head can become difficult or even impossible without pain. The synovial fluid in a healthy joint acts as a lubricant and shock absorber. In osteoarthritis, this fluid can become thinner and less effective, or sometimes increase in volume due to inflammation. These changes can contribute to joint swelling, pain, and reduced ability to cushion the joint during movement. Osteoarthritis doesn't always progress in a straight line. Many people experience flare-ups, where symptoms suddenly worsen for days or weeks. These episodes can be triggered by overuse, injury, or even changes in weather. Flare-ups are often marked by increased pain, swelling, and stiffness, making daily activities more challenging. As osteoarthritis advances, its impact on daily life becomes more pronounced. Tasks like walking, climbing stairs, or even getting out of bed can require extra effort. People may need to adjust their routines, use assistive devices, or rely on others for help. The loss of independence can be frustrating and emotionally taxing. Living with chronic pain and reduced mobility can take a toll on mental health. Many people with osteoarthritis experience feelings of frustration, anxiety, or depression. The ongoing struggle with pain and the limitations it imposes can affect self-esteem and overall well-being. Support from family, friends, and healthcare professionals is crucial in managing these psychological effects. Several factors can influence how quickly osteoarthritis progresses. Age is a major risk factor, as cartilage naturally wears down over time. Genetics, obesity, previous joint injuries, and repetitive stress from certain jobs or sports can also accelerate the process. Understanding these risk factors can help individuals take steps to slow progression. Diagnosing osteoarthritis involves a combination of medical history, physical examination, and imaging tests like X-rays or MRI. Monitoring the progression of the disease is important for adjusting treatment plans. Regular checkups help track changes in joint structure, pain levels, and mobility, allowing for timely interventions. Inflammation plays a key role in the progression of osteoarthritis, especially in the later stages. While osteoarthritis is not primarily an inflammatory disease like rheumatoid arthritis, chronic low-level inflammation can accelerate cartilage breakdown and worsen symptoms. Managing inflammation is an important part of treatment. Genetics can influence both the risk of developing osteoarthritis and the speed at which it progresses. Some people inherit genes that make their cartilage more susceptible to damage or their joints more prone to inflammation. Family history is an important consideration when assessing risk and planning preventive strategies. Carrying excess weight puts additional stress on weight-bearing joints like the knees and hips. This increased load accelerates cartilage breakdown and speeds up the progression of osteoarthritis. Weight management through diet and exercise is one of the most effective ways to slow the disease and reduce symptoms. Previous joint injuries, such as fractures or ligament tears, can increase the risk of developing osteoarthritis in the affected joint. These injuries may disrupt the normal structure and function of the joint, making it more vulnerable to cartilage breakdown over time. Protecting joints from injury is important for long-term joint health. Jobs or activities that involve repetitive joint movements or heavy lifting can accelerate osteoarthritis development. Over time, repetitive stress can wear down cartilage and increase the risk of joint damage. Ergonomic adjustments and regular breaks can help reduce this risk. Osteoarthritis is often described in stages, from mild to severe. In the early stage, cartilage damage is minimal and symptoms are mild or absent. As the disease progresses to moderate and severe stages, cartilage loss becomes more pronounced, pain increases, and joint function declines. Recognizing these stages helps guide treatment decisions. In the mild stage, cartilage may show early signs of wear, but joint function is largely preserved. Symptoms, if present, are usually mild and may include occasional stiffness or discomfort after activity. Many people remain in this stage for years with little progression, especially if they maintain a healthy lifestyle. As osteoarthritis moves into the moderate stage, cartilage loss becomes more significant. Pain and stiffness are more noticeable, especially after periods of rest or increased activity. Swelling and reduced range of motion may also develop. At this point, daily activities may start to be affected, prompting people to seek medical advice. In severe osteoarthritis, most of the cartilage is lost, and bone-on-bone contact is common. Pain is often constant and can be disabling. Joint deformity, instability, and significant loss of function are typical. At this stage, surgical options such as joint replacement may be considered to restore mobility and relieve pain. For those with advanced osteoarthritis, joint replacement surgery can offer significant relief. This procedure involves removing the damaged joint surfaces and replacing them with artificial components. While surgery carries risks, it can dramatically improve pain and function for people who have not responded to other treatments. Most people with osteoarthritis manage their symptoms with non-surgical treatments. These include physical therapy, medications, weight management, and assistive devices like braces or canes. Lifestyle changes, such as regular exercise and a healthy diet, can slow progression and improve quality of life. Physical therapy plays a crucial role in managing osteoarthritis. Therapists design individualized exercise programs to strengthen muscles, improve flexibility, and maintain joint function. Regular physical activity can reduce pain, enhance mobility, and slow the progression of joint damage. Various medications can help manage osteoarthritis symptoms. Over-the-counter pain relievers, anti-inflammatory drugs, and topical creams are commonly used. In some cases, doctors may prescribe stronger medications or injections to reduce pain and inflammation. Medication plans are tailored to each individual's needs and stage of disease. Assistive devices such as canes, walkers, or braces can help reduce joint stress and improve mobility. These tools provide support, making it easier to perform daily activities and maintain independence. Using assistive devices early can prevent further joint damage and enhance quality of life. Adopting a healthy lifestyle is key to managing osteoarthritis. Regular low-impact exercise, a balanced diet, and maintaining a healthy weight can slow disease progression. Avoiding activities that put excessive strain on joints and using proper techniques during movement can also help protect joint health. Certain nutrients may support joint health and help manage osteoarthritis. Omega-3 fatty acids, antioxidants, and vitamins like D and C can reduce inflammation and support cartilage repair. Consulting with a healthcare provider or nutritionist can help create a diet plan tailored to individual needs. Catching osteoarthritis early allows for more effective management and can slow progression. Early intervention includes lifestyle changes, physical therapy, and sometimes medications to control symptoms. Recognizing early warning signs and seeking medical advice promptly can make a significant difference in long-term outcomes. Self-management is a cornerstone of osteoarthritis care. This includes staying active, managing weight, using pain relief techniques, and pacing activities to avoid overexertion. Education about the disease empowers individuals to take control of their health and make informed decisions. Support from family, friends, and healthcare professionals is vital for managing osteoarthritis. Emotional encouragement, practical help, and access to resources can make daily challenges more manageable. Support groups and counseling can also provide valuable advice and a sense of community. Regular monitoring of osteoarthritis progression helps tailor treatment plans and identify complications early. This may involve periodic imaging, physical exams, and tracking symptoms over time. Staying proactive with healthcare appointments ensures the best possible management of the disease. Preventing further joint damage is a key goal in osteoarthritis management. This includes avoiding high-impact activities, using proper body mechanics, and protecting joints during daily tasks. Early intervention and consistent self-care can help preserve joint function and minimize pain. Research into osteoarthritis is ongoing, with new therapies on the horizon. Advances in regenerative medicine, such as stem cell therapy and cartilage repair techniques, offer hope for more effective treatments. Staying informed about emerging options can help individuals make the best choices for their care. Despite its challenges, many people live active, fulfilling lives with osteoarthritis. Adapting routines, using available resources, and maintaining a positive outlook can make a big difference. With the right strategies, it's possible to manage symptoms and continue enjoying favorite activities. To sum up, osteoarthritis is a progressive condition that develops over years. It starts with subtle cartilage changes and advances to joint pain, stiffness, deformity, and loss of function. Understanding the stages and risk factors can empower individuals to take proactive steps in managing their health. Osteoarthritis develops gradually, with early changes often going unnoticed. Risk factors like age, genetics, obesity, and injury can influence progression. Early intervention, lifestyle modifications, and support systems are essential for managing symptoms and maintaining quality of life. While osteoarthritis is a chronic condition, ongoing research and new therapies offer hope for better management and improved outcomes. Staying informed, working closely with healthcare providers, and adopting a proactive approach can help individuals live well despite the challenges of osteoarthritis. There are many resources available for those living with osteoarthritis, including patient organizations, online communities, and educational materials. Reaching out for support and staying connected can make the journey easier and more manageable. Remember, you're not alone in facing osteoarthritis. Osteoarthritis is a journey that unfolds over time, with each stage presenting its own challenges and opportunities for management. By understanding how the disease develops and progresses, individuals can take charge of their health and work towards maintaining mobility and quality of life. With the right knowledge and support, living well with osteoarthritis is possible.